So let me begin by first saying, in the way we work, there are no resistant clients. There are generally resistant therapists. If the client says, I want to feel better, but cannot tell you what better would look like in life, then the mind has not been given enough direction yet. And if the mind does not know where it is going, it cannot organize itself very effectively in that direction. Therapy and coaching are really about creating alignment between what the client chooses consciously and what they are able to do unconsciously. So, unconsciously, many a times people end up choosing the pain rather than choosing the desired future.
If those reasons are not strong enough, what we later call resistance may simply be the mind saying, you have not yet convinced me.
One of the most common errors is trying to lead before sufficiently pacing. If you try to push the clients towards an outcome without first joining their current experience accurately, the mind often pulls back. And then people call that pullback resistance, when in reality, it was the pacing that was inadequate.
Resistance, then, is often not something to defeat, it is something to decode. It may be a sign of unclear outcome, vague tasks, insufficient future motive, poor pacing, or an unaddressed positive intention. Sometimes what looks like a resistance is the beginning of an understanding. What if resistance is not defiance? What if it is not laziness, lack of motivation, or self sabotaging either? What if, in many cases, resistance is actually feedback? Feedback that something is still unclear, insufficiently defined, poorly placed, emotionally unconvincing, or in conflict with another important need. Welcome back. Today, we are unpacking one of the most misunderstood words in therapy, coaching, and change work: resistance. We are doing it through a lens that is much more useful than labeling the client, a lens that asks, what is this response trying to tell us? If you have ever sat with a client and thought, they know what to do, so why are they still not doing it? This conversation is for you. If you have ever wondered whether hesitation, avoidance, non compliance, and doubt should all be placed under the same label, this episode is for you too. I am your host Kiran Khullar once again, and we have Nitin Shah here to give some insights on this episode, number 7. Nitin, let me begin right here. When people say this client is resistant, what do you think they are usually missing?
So let me begin by first saying, in the way we work, there are no resistant clients. There are generally resistant therapists. Okay. So as long as the client is coming to us out of their free will seeking help, I don't think calling them a resistant client is a good idea. Anyways, now coming back to your question. So your question is, what are they missing? They are usually missing the process. Because the moment you label the client as resistant, you stop asking the more useful questions. What exactly is this response trying to tell me about the way this case is being understood, paced, or worked with? Many times, the client is not resisting the change itself. What looks like resistance may simply be the mind responding to vagueness, lack of clarity, poor sequencing, or insufficient unconscious balance. So instead of saying, this person is difficult, I would rather ask, which step have we not completed properly yet?
So that already changes the emotional tone of the work, because now we are not asking what is wrong with the client, we are asking what is incomplete in the process.
Exactly. And before we jump to deep explanations, we should first examine the obvious layers. Is the problem clear? Is the outcome clear? Is the task or the trigger clear? Does the client know what specific changes they're trying to create? What would prove that the change has happened? And what actions would move them in that direction?
So, not all stuckness is defense, sometimes it is poor definition.
If the task is vague, that is not necessarily resistance. If the outcome is vague, that is not necessarily resistance. If the client says, I want to feel better, but cannot tell you what better would look like in life, then the mind has not been given enough direction yet. And if the mind does not know where it is going, it cannot organize itself very effectively in that direction.
That is such an important distinction because it means that the practitioner has to earn the right to go deeper by first becoming clear.
Yes, we should not use deep explanations where a simple explanation is sufficient. And we should not bypass steps just because bypassing sounds advanced. Most of the time, bypassing steps only delays progress.
So let us talk about motivation because this is where many practitioners get confused. They think the client has said they want change, so motivation is
That
present.
is such an important
But
distinction
that is not
because
enough
it means
always.
that
Is
the
that
it's
practitioner
not enough.
has to earn the
Conscious choice
right
is
to go
important.
deeper
But therapy and
by
coaching are
first
really
becoming
about
clear.
creating alignment between what the client chooses consciously and what they are able to do unconsciously. Clients usually come willingly. So the conscious part has already said yes. The problem is that some other part is not fully cooperating yet. That is why future work matters.
So
When
let
the
us talk
client
about
creates a
motivation
sufficiently
because this is
detailed
where many
future,
practitioners
the
get
unconscious
confused.
begins to
They
understand
think
why this
the
change is
client has
worth the
said
effort.
they want
It
change,
begins to register
so
both the
motivation is
reward and the
present.
cost.
But that
What
is not
becomes
enough
possible if I
always. Is that
change
so?
and what continues if I don't.
So, a vague future creates weak motivation.
Current pain can still feel safer than an unclear future. I've heard people saying that a known devil is better than an unknown angel.
Right.
It's something like that, right? My current pain is known to me. The future is unclear, it's unknown. So, unconsciously, many a times people end up choosing the pain rather than choosing the desired future. This is why I often say we do the future consciously, but the work is really for the unconscious because the unconscious needs reasons too.
And if those reasons are not strong enough, what we later call resistance may simply be the mind saying, you have not yet convinced me.
Yes, and that is usually a feedback that we are receiving. It's not a failure.
So let us make this real with a clinical example. Say a client agreeing to homework, keeps saying the right things in the session, but comes back saying, I remembered, but I still did not do it. A lot of practitioners instantly label that as resistance. How would you think about it?
First, I would not collapse all non compliances into one category. There is a difference between forgetting, not understanding, and remembering but not doing. If they forget, it may be a routine or a memory issue. If they do not know what to do, it may be a planning or a clarity issue. But if they remembered and still did not do it, then I become curious about what positive intention may be maintaining that non action.
So the non compliance becomes diagnostic data.
True. Let us take a simple example. A client has identified a usual daily statement or behavioral step, and they even remember it at the right time, but they still continue to avoid it. That tells me some part of the client is not simply absent minded. Some part is literally objecting to the change that we're trying to create.
Not because the client is bad.
No, the client is not bad. They're selected to come to you for a session. If nothing, just give them credit for that choice, right? So they're not bad. It happens because the client's mind is trying to protect something, preserve something, or avoid some anticipated cost. And until we understand that, pushing harder usually does not help.
So, can you give an example of what this hidden positive intention might sound like?
Sure. Sometimes the part maintaining the non action is trying to prevent over. Sometimes it is trying to prevent disappointment. Sometimes it is trying to prevent other people from judging the client. At times, the mind may be trying to avoid rejection, failure, or discomfort of becoming more visible. So the behavior is dysfunctional, yes, but from that part's perspective, the intention is still positive. No, the client is
That
not
is a
bad. They're
radical
selected to come
difference
to you for a
stance from
session. If
just be
nothing,
more
just give them
disciplined.
credit for that choice, right? Yes,
So they're not
because
bad.
discipline without
It
alignment
happens
becomes force.
because
The client's mind is
and
trying to
forced
protect
compliance may
something,
work
preserve
briefly,
something, or avoid
but it
some
often does not sustain.
anticipated cost.
What
And
we
until we
want is
understand
for
that,
the new
pushing harder
response to
usually does not
become.
help. More natural, more automated, and more internally supported.
This also connects with pacing,
Sure.
doesn't it?
Sometimes the
Because
part
sometimes the
maintaining
therapist or coach
the
has
non
simply
action
moved too
is trying to
fast.
prevent over. Sometimes it is
Absolutely.
trying to
One of
prevent
the most common
disappointment.
errors is trying
Sometimes
to
it is trying
lead
to
before
prevent
sufficiently pacing
other
if
people
you try to push the
from
clients towards an
judging the
outcome
client.
without first joining
At
their
times,
current experience accurately,
the mind may
the
be
mind
trying to
often pulls
avoid
back.
rejection,
And
failure,
then
or
people
discomfort
call
of
that
becoming more
pullback
visible.
resistance.
So the
When in
behavior is
reality,
dysfunctional,
it was the
yes,
pacing that
but
was
from
inadequate.
that part's perspective,
So the issue is not
the
just
intention
what
is
is
still
said,
positive.
but the order in which it is said.
Yes. Good process, respect, sequence.
Yes,
You
because
pace before
discipline
you
without
lead.
alignment becomes
You
force.
clarify
And
before you
forced
condition.
compliance may work
You
briefly,
identify the
but
trigger
it often does not
before you
sustain.
expect the new
What we
response to
want
activate.
is for the new response
And
to
you do not
become
expect
more natural,
sustained
more
behavioral
automated,
change
and
from
more
willpower alone
internally supported.
when the unconscious has not been properly prepared.
That actually reflects ICHAR's style of case conceptualization too. You do not jump straight to trauma or deep
Absolutely.
causation
One
because
of the most common
that
errors
sounds
is trying to
sophisticated.
lead
You
before
move
sufficiently
layer by
pacing.
layer.
If you try to push the clients towards
This
an
is one
outcome
of those
without
things
first
which
joining their
is
current
extremely
experience
important in the way
accurately,
we work.
the mind often pulls
If
back.
the problem can be
And
solved at
then
the level of
people
clarity,
call that
solve it there.
pullback
Don't
resistance.
overcomplicate it.
When in
If it
reality,
needs thought
it
work,
was the
do
pacing that
thought
was
work.
inadequate. If it needs behavioral specificity, we do that. If it needs positive intention work, then we work with a positive
Yes.
intention. Good
Depth
process,
should come from
respect,
necessity,
sequence.
not from habit
You
or
pace before you
ego
lead.
or because it makes me
You clarify
look more
before
intelligent.
you condition.
To explain it a little more, let's bring in a second example. Imagine a client says, I know I need to put myself out there professionally, but every time I think about posting online or becoming visible, something in me freezes. How would you unpack that without lazily calling it resistance?
Okay. First, I would make the behavior specific. I will ask the client to clarify what putting myself out there means. This is too vague. What exactly are you not doing? I would wait for the client to clarify this. Are they not writing the post? Are they not recording the video? Are they not editing it? Are they not scheduling it? Or have they done all of this? They're just not pressing the publish button. Because vague problem statements create vague interventions. Once I know exactly what specific behavior the client is stuck with, I have greater flexibility to help the client with that.
So, again, clarity first.
That more or less I can say always. Let us say the actual stuck point is pressing publish. Then I want to know the thought or prediction that appears at that moment. Is it people will judge me? Is it if I become visible, expectations will increase? Is it if this does well, I will have to keep showing up? These are different issues. And I would like the client to be able to articulate their issues clearly and effectively.
And those thoughts may reflect a positive intention too.
Yes, a part may be trying to protect the person from judgment or rejection or pressure of success or from inconsistency and other things. Like we discussed earlier, these are all different layers that or different positive intentions that people may have. So, again, we are not dealing with some mysterious enemy inside the client. We are dealing with a system that believes non action is safer than action for some reason.
That is such a useful reframe because the moment you see the behavior as protection, your stance changes.
Two, you become less judgmental and more strategic. Now you can ask, what would this part need in order to feel safe enough to cooperate? Would it require more clarity? Does it need to know a smaller step? Is there a different thought that we can help the part trigger? Or is there a different sequence? Once we know this, we can start working with this.
So let us stay with the language for a moment because labels become very slippery in therapy. Once you call someone resistant, that word starts doing too much work.
Yes, and it often reduces curiosity. A label should help you think more clearly, not stop you from thinking. If a label closes inquiry, it becomes clinically expensive.
What language would you rather practitioners use internally?
Okay, so if there are two practitioners talking to each other, using labels is okay because it saves you time from having to describe every symptom that the client has, right? Though when you're looking for specific suggestions, supervisions, probably labels are still not a good idea. As far as internal dialogue is concerned, when the client is in front of you, and as a practitioner, you have certain questions in your mind. These questions should be related to the process. For example, what is unclear here? What is unconvincing here? Is there a step that has been bypassed? What is that step? Is there a behavior that is still too vague? What is that behavior? What thought is appearing at the moment of action? What positive intention might be maintaining the old pattern? Those questions keep the therapist active, respectful, and useful. And again, I know there is a degree of repetition that we are doing over here, but that's intentional because this clarity is extremely important when you're working with clients. And hopefully, this reinforcement would condition these questions, these ideas in your mind.
This preserves client dignity too, right?
That's true. Because the client is no longer seen as the problem, the stuckness becomes information. And
What
once
language would you
stuckness becomes
rather
information,
practitioners use
it can guide the next
internally?
intervention.
There is also an ethical dimension here, isn't there? Because once we stop fighting the client, the work becomes more collaborative.
The stance has to remain win win and client centered. We are not here to overpower the client, out argue the client, or impose our preferred answers. We are here to help move towards clearer choices, better alignment, and more useful actions by helping clients get clarity about what these are. And this clarity needs to come at the level of client. It can't be forced upon by the therapist or the coach.
And that means respecting autonomy too.
Absolutely. The therapist helps the client explore consequences, options, skills, thoughts, and blocks more objectively. But the client's life remains in the client's hand, it's the client's life. That is why our role is facilitative and not authoritarian. Even when unconscious work is involved, the aim is alignment and cooperation, not control.
So, in a way, this whole episode is a plea for more respect in how we understand stuckness.
More respect, more empathy, more compassion, having an unconditional
This
positive
preserves
regard for the
client
client.
dignity too, right?
So, all of those things that form the primary principles of humanistic approach, a client centered approach. Yes, this episode is a plea for respect in that direction. Respect the symptoms enough to ask what
There
is
is
going
also
on
an
here.
ethical dimension here,
Respect the
isn't there?
timing enough
Because once we stop
to not rush.
fighting the client,
Respect the
the
process
work becomes
enough
more
not
collaborative.
to bypass steps. And respect the unconscious enough to recognize that if it is not cooperating, it usually has a reason.
That feels like the perfect place to pause. Resistance, then, is often not something to defeat, it is something to decode. It may be a sign of unclear outcome, vague tasks, insufficient future motive, poor pacing, or an unaddressed positive intention. And the better our process, the less we need to blame the client. Thank you, Nitin, for this insightful episode.
Thank you, Kiran. Thank you for hosting this episode. And this that line that you used, that resistance is not something to defeat, it is something to decode. I think that is the core learning that I would like every viewer, every practitioner who is following us to take back. And obviously, if any of those who are watching us, listening to us, are now looking at developing advanced practitioner skills, everything that we are discussing, everything that we do comes from the cognitive hypnotic psychotherapy framework. It's a framework that I recommend to every practitioner. If you are someone who's serious about developing advanced practitioner skills, working with clients in a client centered manner, then I would recommend explore the courses we offer. And I'm sure to help you address whatever questions you have. And I hope to see you soon in one of the workshops that we offer. Thank you.
In the next episode, we go one layer deeper. If this conversation helped you rethink resistance, the next one will help you understand the system that is often being described when people talk about deeper change work. Our next episode is titled Working with the Unconscious Mind in Therapy. We will explore what the unconscious mind actually means in practice, how it shows up in behavior, why conscious insight is sometimes not enough, and how to work with it without becoming mystic, vague, or manipulative. Until then, keep listening beneath the label. Sometimes what looks like a resistance is the beginning of an understanding. Thank you, everyone, for listening.
Thank you. Thank you, everyone.